Hello, I'm Dr. Maurie Markman from the University of Texas MD Anderson Cancer Center, and I would like to briefly discuss the results of two very important randomized phase 3 trials. The first published in the February 10th issue of the Journal of Clinical Oncology, that's 2009, and the second in the February 5th, 2009 issue of the New England Journal of Medicine. These studies examined the addition of epidermal growth factor blockade plus anti-angiogenesis therapy plus chemotherapy in the management of metastatic colorectal cancer. It has been known for a considerable period of time, based on the results of randomized phase 3 trials, that either of these two strategies individually plus chemotherapy impacts outcome in metastatic colorectal cancer in a very favorable manner. It had been assumed by many that by combining these two strategies with chemotherapy, outcome would be improved even further. These two studies demonstrated that was not the case, and in fact, the use of an anti-angiogenesis strategy with blockade of the epidermal growth factor receptor and chemotherapy resulted in an inferior outcome. Clearly, much more work needs to be done to understand why this result occurred, but it's important to point out that these trials emphasize two very relevant points. First, the absolute need for the conduct of phase 3 randomized trials of all new concepts in the management of cancer. Clearly, a strategy may seem like a wonderful idea and may have great theoretical potential, but it's important that the benefits be proved in the context of a phase 3 randomized trial. And it's also important to point out that these studies clearly emphasize our limited understanding of many of the complex molecular events that go on in both the initiation and the progression of metastatic cancers. I think we have to be humbled by our knowledge. We clearly need more knowledge. We clearly need to support research, ultimately leading to evidence-based trials. But I think these studies really demonstrate we have much more to learn. I would encourage you to read both of these very important papers that recently appeared in the peer-reviewed medical literature. Thank you for your attention.